Hello, everyone. Welcome back to All Aboard with Rob Belliveau. I'm Rob Belliveau, and thankfully the host again for this episode to bring in somebody in studio, which is always a treat, Kris Lane with the College of Physicians and Surgeons of Nova Scotia. Kris, welcome.
Thank you so much. It's great to be here.
Thanks. Thanks for coming in. So, Kris, tell us a bit about your role with the College of Physicians and Surgeons of Nova Scotia.
Right.
And what is the college? What are they a university? Are they a college? What do they do?
Yeah, sure. It's a little confusing for people. So my title is just as long as the organizational title. I'm the Director of Programs and Allied Health Professionals.
Okay.
With the College of Physicians and Surgeons of Nova Scotia.
Wow.
We often call me the Director of Things. I have a very varied portfolio.
Okay.
So some of the programs that I run, the Welcome Collaborative, of course, which we're going to talk about today.
Go deep dive today.
Absolutely. The Practice Enhancement Program, which is a quality improvement program for physicians. Mm-hmm. The Health and Practice Program, which supports physicians in having safe practice through health issues. Mm-hmm. And also the regulation of podiatrists and physician assistants, which just started in April 2024.
Get a gold star for remembering all of that so succinctly. I would forget part of my job if I had your job.
And maybe I did. Who knows?
So we're going to talk a bit more about the Welcome Collaborative. So, Nova Scotia province here in Canada, not unlike many provinces and territories in Canada and also across the United States and many parts of the world, healthcare is there's problems everywhere. There's great people out there like you trying to help solve those problems. And, we'll talk a bit more about some of the technical solutions of what you're doing. But in Nova Scotia, we have the Welcome Collaborative, which is a program that helps see physicians outside of North America come in and go through the program. What is the program, and what were some of those gaps or frustrations that the program was filling to help solve a doctor shortage in Nova Scotia? And I just want to say on a personal note, it's wild for me to have a podcast to be talking about improving healthcare in this beautiful province, and it's an honor to have you here. So what is this program and what's going on?
Awesome. Yeah. So first of all, I have to not take credit for the program myself. It was sort of dreamed up by our registrar and CEO, Gus Grant, in conjunction and collaboration with a lot of system partners. Understanding that there was a gap with internationally trained physicians, that we needed to support them better. So the college decided that we would run the program. Our provincial government, through Labor, Skills and Immigration, funds the program. Mm-hmm. And it really is meant to be an orientation to a system that is not familiar. As Gus would say, if you know one healthcare system, you know one healthcare system.
That's right.
So coming in, physicians were feeling disoriented and really needing some foundational background to start their practice effectively.
And so they come in, they're trained from other places. We need and want them to help us with our healthcare problems in Nova Scotia. And there's some gaps. So you talk about, the healthcare system in Nova Scotia, while, would be great if anything was universal across Canada and the world, it isn't. What were a couple of those key gaps or frustrations that the collaborative was seeing and wanted to solve?
Yeah, absolutely. So what we were seeing from a college perspective is some of the sort of cultural norms. It was important to really lay a foundation there. Some of the system norms like billing, documentation with medical record keeping. Canadian medical law is different than other countries, and practice management. We're asking physicians to not only come in and bring their skills, but also be a business manager suddenly, right? So how do you start up a practice? How is that sustainable? So some gaps there. And then just navigating the daily life, like, where do I live? What schools do my kids go to?
Banks.
Yeah.
Transit.
How do I get a bank
Fundamental
account?
things, really.
Yeah. Credit. Yeah. You can't just walk in with a bunch of cash, right? Yeah. You need to have credit to do things. So how do I get a car? How do I get insurance? Those kinds of things.
It seems so broad, and rarely do I ever spout theory on this podcast, but, we talk about Maslow's hierarchy of needs. We're thinking about doctors coming in who are clearly highly skilled and trained from wherever they came from. But we're actually talking about acquainting them with transit systems, banks, housing, we're talking about that fundamental human need that exists for everyone. We're not even talking about the actual professional doctor skills yet, are we?
Right. No, we're not. And sort of what we focus on as the regulator is making sure that practice is safe and competent and all of that kind of thing. But also to bring those partners together and to be able to share the proper resources for those settlement pieces is really important. And one of the reasons that Labor Skills and Immigration saw the need and the desire for that.
Yep. Great segue down into, let's a little more about the Welcome Collaborative. I'm a physician coming from overseas. I want to be here in Nova Scotia. I'm looking forward to being here in Nova Scotia. I sign up for this program. I'm told I have to do this program. And then what does that program look like for them?
Yeah, so that's a good question. When you're licensed in Nova Scotia as an internationally trained physician, you have a licensing agreement. And within that licensing agreement, it says that you need to complete the Welcome Collaborative within the next 6 months.
Oh, okay. So it's mandatory now.
Absolutely, it's mandatory. And I think that's really equitable. We're saying, you need these resources. We're going to bring you in. You're going to be oriented to all of the things that we think are important. And also, we're going to take your feedback about what we might have missed.
For improvement down
Absolutely.
the road. Yeah.
So really, you come in, we have cohorts. So we do 5 sessions a year now. So we bring people in. They may have just arrived. They may be in practice for 2 or 3 months. But there's a group of them that come in together, and we have presenters who come in. And so depending on your specialty and your area of expertise, you might be there anywhere from 3 to 5 days.
Okay.
And
this is in person, 3 to 5 days. Right now, we're talking about in person. We're going to get to the fun stuff in a minute.
That's right. So in person at the college, which also has its benefits. The regulator is often seen as sort of the iron fist, right? But it gives us an opportunity to really explain what we do.
Humanize it, really.
Absolutely. Who we are, what we do.
Yeah.
And also build a relationship from the beginning and be clear on what our expectations are and that we are quite a supportive organization overall.
Yeah, I mean, it's so important in education, whether it's in person, online, that, if you think about some of the best teachers or professors you've ever had, while they are all very technically knowledgeable and competent, it's the ones that you had a bit of a relationship with trust, right? And I think what that in-person experience, while we are going to talk about online learning and we are an online learning company, it's actually not the silver bullet for everything. That in-person experience builds up that fundamental trust to then be able to help move the educational dial. And it sounds like you found that mixture of getting them in person, building up for that programming, and bringing in experts around them to pull it in. We mentioned already some of the topics, which are super broad, but this is really broad. This is employee onboarding, not 101, 501. How did you shape what is now currently the curriculum to get it in still a manageable time with reasonable objectives?
Well, and this is one of the really cool things that we were able to do is draw on the experience that's already in the province. So 33% of our physicians are internationally trained. And before the Welcome Collaborative existed, we still had all those folks coming in. So we were able to talk to some of those internationally trained physicians and say, what would have been really good for you to know in the first 6 months of practice?
Yeah.
And unfortunately, this might not help you, but let's help all those who are coming in after you. So we had focus groups, we did some surveys, and put together what we thought was a really solid curriculum to start. And I mentioned that we do evaluation throughout. So we have added, it started as 3 days, it's now 5.
Yeah.
So we've added based on feedback, and we've changed based on feedback.
Changing. And so you're getting that, that continuous input of feedback. You're getting the people, as we say sometimes in industry, the boots on the ground, giving you the information. Then we talk about online learning. And very often in this podcast, we talk about the tracks that tie me and our guests together. And in this case, Brightspace is a tool that you're using to deliver the theoretical and some of the resource information to the doctors in the Welcome Collaborative. You've partnered with Neon Train, thank you so much, to help do that. What was the catalyst to start blending and getting some of that online? We know the value of the in-person, but what was that catalyst to reach out to us and decide to get some of this online?
the stuff, right? Here are the resources. Here's some background. Here are some things to watch. And then you can come in and in the in-person, you can make the most of it and have that sort of discussion. And like you said, humanize it, right?
And really, when we talk about that in the blended learning model, you're giving them what they need or should know and can read on their own in their own time ahead of then meeting in person and actually putting it into action and having the people there be coaches or guides to help them get through what they maybe didn't understand or what was still foggy for them. So are you seeing that trust then build further in the in-person because of the online?
Absolutely. We are, in the beginning, I don't know, you've probably worked with a lot of learners. It's really hard to get people to do things ahead of time.
Yeah.
And like, can you prepare for this, please? And somebody shows up and goes, I didn't read any of that.
Yeah.
We had a lot of that in the beginning. And so we've kind of made it into digestible chunks now. So we have just a couple of webinars to watch before you come in. Then the really great part about Brightspace and about Neon Train is that all of those resources are available to them for another 6 months after they do the program. So after they're in person. So we add resources. We have all the presentations available to them. We know that it's like drinking from a fire hose. So we know they're not taking it all in. They can go back to those resources and even reach out again and ask questions, right?
Go back on it, yeah.
Absolutely.
You threw in that fire reference. I think some of our listeners know I have a past as being a professional firefighter and training officer. So I appreciate that analogy. And often in online learning, in any training program, organizations do feel the need to get everything out as quick and as fulsome as possible, but really that is overwhelming for the learner. So when we talk about chunking the material out, whether it's into micro lessons or smaller digestible modules, you're making it approachable for them to start and finish it in a guaranteed kind of time frame, and then move on. So I think that's super smart of how you've designed that program, which brings us to more of the effectiveness of it. You've made it mandatory in Nova Scotia since September 2022, which was a new fact I didn't even know coming into this today. And I always say we like to leave listeners with things that they learn. I learn on the podcast, so thank you for that.
Sure.
What has the college seen since then to now with that? We talk about the program, we talk about delivering it online. What are the results out there in the field as far as the doctors, giving feedback of they're in their placements, they're in their towns, they're in the cities? Is it working?
I believe so. I mean, some of the feedback we get about the program itself, one of the objectives starting the program was that we wanted everybody to feel more confident. So we wanted not just the physicians, but their peers, their patients, everybody to have more confidence. We're hearing from supervisors and from peers, can they do the program sooner? That means it's working.
Wow. Normally people are like, no, don't make me do it. Now people are actually seeking it. They're questing.
Yeah, we have physicians reaching out who might not necessarily be internationally trained saying they'd like to do the Welcome Collaborative.
That's really cool.
Yeah, and we hadn't actually we hadn't thought too much about U.S. trained physicians because we didn't have a lot of them coming in. But over the last year or so, we've had more U.S. trained physicians coming in.
Okay.
And we had some go through the program the last session, and it was quite useful. The American system is quite different, and so it's a new thing we're looking at, and I think we'll offer that to them as well moving forward.
We'll continue to do it.
Yeah.
The physicians that go through it, it's now mandatory. They do some online learning. They go in person with other physician peers that are helping execute it. When they leave the program, they have access to the online materials through the system. They can carry on. What does that next 3 and 6 months after the program look like for them when they still have access to the material, but they're out actually getting their feet wet?
I mean,
practicing.
I hope they're able to take a lot of what we teach and what we give and implement it into their practice, and that there's not so much scrambling for information. While they're in the sessions, they also, and this is another really great thing about having the learning management system, is that they're asking questions in the sessions. Oh, how do I find this? Where do I get this? And we have our learning and development lead in the room and she is actively adding things
Amazing.
to the system as we're in the room. So it's really cool for them to be able to go back and go, that question I asked, they added that piece. I can go in and look at it. I can download it.
Yeah.
So I'm hoping that they take away from that all the resources are there and they can put those things into practice right away.
Yeah. There's definitely something to be said about continuous improvement, which is what you're clearly doing, but also using the system a little more responsive and adaptive than sometimes it's used in institutions or organizations, that people build a course and they think, we got to build this course. This is it. You send it out and that's it. And you don't do any updates until maybe the next time or next time. You're adapting it right on the fly. That's really cool.
Yeah, and it's just recent that we hired our learning development lead, but having her in the room is invaluable because literally I'm going, oh, we need to add this resource. I'm sending her a message across the room and then I look on it and it's there, right?
Wow.
And so I can tell the physicians, okay, it's on there for you now.
Yeah. And the experience, you have a learning and development lead that's new in the organization since we've started certainly working together. They've been getting used to Brightspace as a tool and as a platform to help do that quick hit. It's even the first time I've heard that that's happening. So that's two things that I've learned from you today. How's that technical experience been? Because a lot of organizations think online learning, oh no, another piece of tech, another system, another whatever. I don't know if we can or should do that. It sounds like it's become pretty easy.
Yeah, absolutely. I think she's really adapting to using Brightspace and in talking with you folks about what you can offer and what features she can kind of add in. Mm-hmm. And one of the reasons that she came on board is because I really wanted to make the online offerings really user-friendly and really engaging and not just pre-recorded sessions.
Yeah. The ability to have material there, again, really good, effective online learning isn't just information to read and then do some assessment. It's actually working with, playing with, interacting with the content, the material, and actually, practicing before you actually do. And I think you're finding that new sweet spot as the program evolves, but that's coming from the learner feedback, which is that full loop that, is really a gold star in online learning. The pathway for that as we think about like moving forward is, where is this going to go? So it sounds like you're doing continuous development. You've got more cohorts than ever. We know we still have more doctors to fill, so the mission is still out there. Where do you see this in another 3, 6, 12, 24 months?
Well, this year we're having 5 sessions. That's one more than we've had over the last 3 years. Mm-hmm. So we've added a session. We've added days. We've added different presentations. One of the questions that I've added to our evaluation is what information or what presentation would have been more useful prior to arriving. So taking a look at maybe moving some of that content online, and then again taking that in-person time and really doing
deep dives, personalized deep dives based on the outputs that you're seeing from the course.
That's right.
Yeah,
that's right.
That's truly, again, highly effective. That's a highly effective program style to have. When you look at the current Welcome Collective right now, and maybe more broadly the College of Physicians and Surgeons of Nova Scotia. I like just saying it because it's so long now. If the college is listening to me in this podcast, please know I'm not making fun of you. It's just a long name. Where do you see this program maybe spinning off in other parts of the college in Nova Scotia or potentially across Canada? What eyes are on you right now?
Yeah, absolutely. Nova Scotia and particularly our college is looked at as an innovator with regards to pathways for physicians to come into the province, to come into the country, and how to support them best because we want them to stay.
We need them to stay.
We want them to stay in Nova Scotia. So there are lots of other provinces that are asking lots of questions. In particular, I'd say, New Brunswick, Newfoundland, specifically the Atlantic provinces, really looking at how to recruit and retain. Understanding that really solid foundational orientation is the way to go to really set people up for success. I do see other provinces adopting this type of program. Whether they'll adopt it exactly as we do it or not, who knows? But
Well, as we said at the beginning of the show, all the healthcare systems are still slightly different,
that's
right?
right. That's right. And I'm glad, and I know that our registrar is really glad that this is looked upon as a really great program and something that people want to model. So
Yeah.
I think we will see it popping up across the country.
We always like to leave our listeners with takeaways or things that they can bring back to the organization. And, I think today, certainly one of the things that was highlighted to me talking about this is, some of the principles here could and should be instilled in any new hire or welcome orientation program for any industry and any job. It's just really opening your mind and your eyes to understanding the diversity of your new employee, your learner, and making sure that you're overwhelming them with useful information. That transportability to another industry, I think is amazing. Whether you're speaking to maybe another welcome collaborative initiator in another province or territory, or somebody out there in an organization that's looking to really make a good inroad in their orientation program, what would be one or two takeaways? Where would they start? What should they think about when they're starting what this is and to get to this point?
Sure, yeah. So I think personally, in all of my work experience in my professional life, what I've found really matters the most to me is how systems feel to people as they move through them. And so when you're designing a program, you want to design the program with the people it's meant for rather than for them. And so I think that would be
that grassroots engagement.
Absolutely. Like what do you need? What can we do? Not this is what I'm going to do for you. And then I think also understanding that orientation is a form of risk reduction. We talk about
100%.
risk management a lot in regulation. It's proactive regulation, really, making sure that we have a solid foundation to work from is setting people up for success.
Well, it sounds like, too, you're really taking the approach where, a basic orientation program satisfies a checkbox, especially when we talk about, risk and risk management. The Welcome Collaborative not only satisfies the checkbox, it reaches into retention, which is really core to so many places, doctors, of course, in Nova Scotia, but other industries. That retention piece is what you're helping solidify right from the start.
Absolutely. And like I said, we want the physicians to stay. Everybody knows that. Everybody wants that, right? But these healthcare systems that we work within are more than just clinical care. It's about understanding how the various systems involved work. And it's about making sure that everybody who's in the system feels like they're part of the system.
Yeah.
Because if you don't feel like you belong, then you're probably not going to want to stay.
Right. So you're creating that. It's really a system of trust, right?
Absolutely.
Yeah. As we kind of cap off today, back to, you've got this program, you're listening to the folks on the ground, you're using other people to help, teach it from the front line. You've brought on a tech partner, Neon Train, with Brightspace. That collaboration, having folks to call on for the technical side of building this thing online or tweaking this tool online. What takeaway would you have for somebody who's thinking of this program saying, we do need to make online learning part of this program? What should they look for, maybe a little selfishly, in a vendor that's going to maybe pitch to them that, we can help you? What have you found with our team, and how would you leave that for other people to consider?
Yeah, absolutely. I think probably one of my favorite parts is that question of what do you need this to do? And being able to have that tailored for us is really important. So I think that's really what you're looking for is you want somebody who's, going to work with you, not for you, not to tell you this is what you need, to ask what do you need? And that's been the really effective piece for us, I think.
That's awesome. I mean, Neon Train has a great team. I'm happy to hear that. I can't take all the credit for it, but we're really appreciative of being able to work with you and again, being able to help solve this problem of getting more trained doctors quicker, better in Nova Scotia. Any last thoughts before we cap off today?
I just like to thank you for having me and talking about the program. It's a wonderful program. I often say it's my favorite part of my job.
Yeah. Well, and you have a long list of jobs. So if that's the favorite one, sorry, the other tasks on there, this is the best one. I hope everyone today has taken something away from this about how effective online learning programs can impact employee orientation, retention, risk reduction. We've covered so many areas today. It's kind of crazy. And also using a technical tool like an online learning system to help deliver it effectively. If you have any questions for Kris, or you want to have any takeaways or information from today's session, you can email us at allaboard@neontrain.com, and we'd be happy to usher that through to Kris and the team at the College of Physicians and Surgeons in Nova Scotia. Thanks, Kris. This was fun.
Thanks so much, Rob.
Amazing. Talk to you soon, folks.